have treated a lot of world-class athletes. I've also treated people at the other end of the spectrum. And by the way, I've taught over 10,000 hours of seminars around the world. So at least it has me exposed to, I would say, at least every major topic on some level. And cardiovascular is a really big topic. So you look, US, North America, 1 in 3 deaths are actually cardiovascular. So this was a guy that I met at a seminar a few years ago. His name's Ron Worley, and I have a full disclosure to share his data. And he created a video to tell his story. But literally, I was teaching an organo event in Colorado, and the Nielsen's had invited Ron, and they said, look, you just need to meet my friend, Dr. Bob. And Ron said, you know, I'm kind of busy. And Deanna was very insistent. She says, you need to meet him. And so she was so insistent, he showed up. And she wanted to introduce him to me, and she did. And I said, well, great. How can I make this day better for you? And he said, well, I don't think you can. I said, well, try me. He says, well, I have this weird cardiomyopathy. I'm on a cardiac transplant list, and you know, my ejection fraction is 10%. I only had a 2% chance of survival. So, you know, I don't really think there's much that anybody can do. And I said, well, you never know, right? So I literally showed him a video, and he talks about it in his video, of this woman who had a severe cardiomyopathy. And by the way, she's 70 years old in that picture. She was on a cardiac transplant list for over a decade. And literally within 6 months, we had reestablished her heart function to that of as healthy as you can be, you know, a 20-year-old. And so for her 50th anniversary, she brought her husband in and said, look, Dr. Bob needs to do a workup on you. But there was Ron Worley in contest shape. And literally, he had dropped dead while giving a talk in front of a room. His wife did CPR. The EMTs got there. They did, you know, the electrical stimulation to bring him back, and the defibrillator and everything else. And they kept him alive. But when they got to the hospital, they said, wow, you've got some weird cardiomyopathy. You know, your only hope is a heart transplant. So he had been on medications for years at that point. He was having 13,000 PVCs. PVC stands for premature ventricular contractions every single day. And within 10 days, and I'll show you the protocol, he was down to less than 800. Now, someone might think 800, that sounds like a lot, but let's just do a simple math, right? So if my heart beats 72 beats a minute, 60 minutes in an hour, that's going to be over 4,200 beats in an hour. There's 24 hours in a day. So that's basically 100,000 beats in a day. So less than 800 is less than 1%. And that's what he did. He went from 13,000 to less than 800 in just 10 days. And here was the protocol. And, you know, I'm happy to share it. And I did a Zoom where I actually shared all the science behind how this can be so good for you. But I gave him a functional medicine food for inflammation and mixed it with OGX. Back then we had OGDX, which is a detox food, vitamin D3, K2, melatonin and theanine every waking hour to buffer the stress in the body, activated omega-3s at a pretty good dose, 2 Ganoderma spores every waking hour, a nanonized form of CoQ10, 100 milligrams 4 times a day, and then time-release lipoic acid from something else that I saw in his blood work. And bottom line is he had a cardiac miracle. So now I'm going to share the rest of the presentation. I'll take questions at the end, why I was so insistent on Ganoderma and Ganoderma every waking hour. So first and foremost, it's proven to lower blood pressure by 3 different mechanisms. So it buffers the stress within the body. It's actually what's known as an ACE modulator, and it drives the part of the nervous system, which is very relaxing, the healing form of the nervous system as opposed to the fight or flight form. So ACE is an acronym. It stands for angiotensin converting enzyme. And angiotensin, I might be speaking Latin to some of you, but angio is blood vessel. Tension is to increase tension within the blood vessel. And that's an enzyme that activates blood pressure. So it's a blood pressure med. And when they take a medical angiotensin converting enzyme inhibitor, now they know that they're at increased risk for COVID death. That's one of the drugs that increases COVID death. So if you could do a natural strategy, you're probably better off there. Ganoderma lowers the bad cholesterol, increases the good cholesterol. Just by way of teaching, HDL stands for high density lipoproteins, And we want our highs high. LDL stands for low density lipoprotein, and our lows low. And that's a good formula for long-term health. The molecule nitric oxide is a fascinating molecule. So if you go back to 1970s movies, you might see a guy that's under stress, and next thing you know, he's clutching his chest and he's in pain. And he takes something, he's fumbling around for pills, and he puts one under his tongue. And within minutes, he's going, and he's breathing easier, and his chest pressure's down. Well, he took nitroglycerin, and it took scientists more than a decade of dedicated research to find out that this nitroglycerin actually increased something in the body called nitric oxide. And nitric oxide dilates blood vessels by as much as 62% a single dose. And it literally was Nobel Prize winning research. So Ganoderma is a powerful regulator of nitric oxide, which is going to be good for our immune system, the rate at which our cells grow. And by the way, if they don't grow enough, then guess what? We can have problems in one direction, or if they grow too much, we can get a tumor that could even be malignant. It's good for our breathing. It's good for our sexual health, cardiovascular system, both the central and the peripheral nervous system, and as well as our gut. So it's a good molecule to have. My dogs are playing, so you can probably hear them in the background. You know what? I'm going to put you in the room. So come on with me. Okay, come on. Fun detour. I was actually doing a license renewal seminar via Zoom, and my wife had to go out and do something, as she did now, and no time to put the dogs up, so they were just having fun there. But back to this. So there's 3 different forms of nitric oxide within the body. There's the kind that lines our blood vessels. That's called the endothelial form of nitric oxide. There's a kind in our brain. That's called the neuronal form of nitric oxide. And then there is the inflammatory form of nitric oxide. And when the body has acute inflammation, that number can increase by more than 1,000x inflammatory nitric oxide. So I show a picture here of a python swallowing a sheep, and my visual teaching aid there is that inflammation devours nitric oxide. And so when you look at how many things around the body nitric oxide is good for, you can see where inflammation would be linked to chronic illness. So Ganoderma reduces the inflammatory process by at least a dozen proven mechanisms, and it does it in a healthy way. We know that when people have a sudden clot formation, they can have an instant heart attack or stroke. So this was a rat study, and they gave rats a clotting agent called kinic acid. And they figured out they could give a dose of kinic acid that would cause heart attack or stroke in 100% of the animals. Then they said, okay, we can cause a heart attack or stroke. Let's then see if we can buffer that. So they literally gave them Ganoderma at a dose of 60 micrograms per kilogram body weight, and that could prevent a heart attack or stroke with even the strongest clotting agent that they knew of. By the way, they could do it with aspirin, but they did it at 10 to 20 milligrams per kilogram body weight. The difference between a microgram and a milligram is a factor of 1,000. So aspirin can do it, but at serious side effects. So if you were to take the level of aspirin that you'd need, that would cause some gut bleeding within days to, maybe a week at the most. But at my body weight, 2 cups of black coffee, which is my favorite coffee, would prevent a heart attack or stroke with the greatest clotting agent. Or at my weight, it would be 9 baby aspirin. And I promise you, Ganoderma coffee is a better choice. Ganoderma prevents abnormal clotting, but does not promote abnormal bleeding. So, the company that we're going to not talk about tonight, but Organo, we're in operational in 36 countries. Not one of our boxes of coffee or tea has a warning label on it, and they all have Ganoderma. So 36 governments realize that this stuff is pretty safe. Little tangent still on the heart. X radiation or ionizing radiation can be damaging to the tissues of the body. And they actually did a study on gamma radiation. So if you're a Marvel Comics fan, the Incredible Hulk, Bruce Banner was belted by gamma rays, and his mutations turned him into the Hulk, a very damaging form of radiation. So Ganoderma actually protects against gamma radiation damage. And there's people that will undergo radiotherapy, they call it, literally radiation to try to kill cancer cells. And if they're doing it for lung cancer, they can often damage the heart. And here's what we know. Ganoderma protects the heart from radiation, protects other tissue as well, and it enhances the killing effect of chemo and radiation. And a very powerful heart toxin is a chemotherapy called doxorubicin. I'm going to close the door so the dogs can play. And I literally have patients in my practice now that 20 years ago took doxorubicin as chemotherapy, and now they have severe heart damage. But if we give them Ganoderma while they're taking some of these toxic agents, the data is there. It protects the heart and critical organs from the damaging effects while enhancing the effects that are desirable from that medication. Mark Houston is a wonderful functional cardiologist, very well published. And he says, look, even though there are over 1,000 biomarkers for cardiovascular disease, there are three and only three causes: inflammation, oxidation, and autoimmune. So we already mentioned that Ganoderma modulates the inflammatory process by at least a dozen mechanisms, but by weight, Ganoderma, also known as reishi, has powerful antioxidant capacity. That is actually from NIH.gov. And then when it comes to modulating the immune system, this is powerful language from the medical literature. Ganoderma can be used to treat and or prevent autoimmune disease. So heart, we've covered the major risk factors. Ganoderma modulates them. We figured some strange things like damage from severe radiation or extreme toxins like chemotherapy. Ganoderma protects against that. Blood clotting from some of the worst clotting agents. Ganoderma protects against that, and in a dose that you can get in just a few cups of coffee a day. Now, when we talk about stroke, when someone has a stroke, they have the initial damage, and then over the course of the next 24 to 48 hours, there's a much bigger area that's typically damaged, and that's called the ischemic penumbra. And Ganoderma is known to reduce or even completely eliminate the ischemic penumbra. So very, very powerful for heart or stroke. A one-slide summary if someone wanted a snapshot of the PubMed references. Yeah, I encourage people to look up all of them, and you're going to find that this is really powerful, really safe, really effective, and should be a cornerstone for nearly any program you put together. It certainly is the top recommendation that I make in my office. So with that said, Carol will now transition to questions.
Certainly. So far, we have only one question, but I'm sure lots more will come from it. How would Ganoderma help with AFib?
So remember when I showed the Ron Worley case, he has what's known as premature ventricular contraction, which is worse than AFib. So the heart has its own conduction system, and the atrium is the smaller portion of the heart, doesn't have as thick muscles. It just moves blood from one section of the heart to the other. The ventricle is the big one. That's what has to circulate it either to the lungs or to the rest of the body. And ventricular fibrillation is much more dangerous. But AFib is just an abnormal nonstop firing of the nervous system in the atrium. And so we have phenomenal success with normalizing that, by the way. And we certainly use Ganoderma. By Ganoderma increasing nitric oxide, that helps. By modulating the inflammatory process, that helps. By alkalizing the system, it helps. But we're also going to stack something on it, an amino acid called taurine, which is a natural stabilizer of the cardiac membrane, and magnesium, which, by the way, is also a stabilizer of the cardiac membrane. So, most of the time we resolve, I want to say this more carefully, most of the time AFib resolves with the protocol that we create. Another common cause of atrial fibrillation is actually thyroid dysfunction. And the most common cause of thyroid dysfunction is actually autoimmunity. And remember, we showed that Ganoderma can treat and or prevent autoimmune disease. So if there's an autoimmune thyroid triggering the atrial fibrillation, then it may take a little more time to get that under control. But there are a lot of mechanisms by which it can help. But as you know, Carol, and I've said it many, many times on these Zooms, we are a very tightly regulated society. We can't make any claims. So that's why I share citations from the medical literature. But here's what I'll tell people across the board. You can take this to the bank. I don't know if it'll help, but it sure won't hurt.
Sorry, it was my question. By any chance, would I be able to ask a little bit more about it?
Go for it.
Thank you. Yes, I understand, and it's great, awesome, thank you. So yes, it is actually my husband who has the AFib, and he is taking magnesium taurine. Also, a very small dose, the smallest I believe, is the fumarate, the isopropyl fumarate. I think it's a very typical drug for AFib. He is nonstop, always in AFib.
Okay.
And a small dose of aspirin, of course. So in that case, what would be the process, or how many portions, or whatever you want to call it, coffee, or should
Here's what I'm going to tell you. Clear this with the doctor, right? Because we can't treat a patient long distance with that little bit of data in determining how much. But
Right.
I'll usually do 5 grams of taurine 4 times a day.
Okay.
I'll do 100 milligrams of nanonized CoQ10. In a case like that, I do it 6 times a day.
Yeah, he takes that as well. Sorry, how many? How much? What was the
100 milligrams 6 times a day.
Yeah, 6 times a day. Okay.
I would do small doses of magnesium, and there's different forms of magnesium. There's actually magnesium taurate, so it has taurine within it. There's a magnesium glycinate, that's a nice one.
Right.
But I take that to bowel tolerance, small doses every single waking hour. I would take 2 Ganoderma spores every waking hour.
Okay.
And then we want to make sure that there's not an autoimmune thyroid going on there. So you
Right.
want to test
Of course,
thyroid
then you
antibodies.
check for that. Yeah. Thank you very much.
You're welcome.
Okay, our next question is about Ganoderma and COPD.
Okay, so yeah, we have some pretty phenomenal testimonials. A gentleman named Wendell Betts, who was 20-something% oxygen capacity, couldn't walk across the room. He was on oxygen, literally started getting better with his first dose of Ganoderma. I have a really nice film of him giving that testimonial. But Ganoderma is known to have lung benefits, but the ultimate question we have to ask is what's causing the problem? And so when we start looking at, and I'm gonna pull up a picture. When you start looking at COPD, sometimes there's a very significant portion of the lungs that is destroyed. And that gets to be a problem. I don't know why my computer's doing this. It's probably not. It's probably just responding to my command. I want to end this and pull up a different picture. And I'm going to bring a gruesome picture up, but I'm going to make a point from it. And I often talk about this when I talk about diabetes, or I talk about the brain, or that's probably going to be okay. All right, I'm going to do a different screen share. Oh, I got to do it here first, don't I? So, share screen. There we are. Wrong one. Get rid of that one. Probably get rid of that one too. I don't know why I'm getting the wrong screen. Which one am I sharing, Carol? Do you see a screen right now?
You just got all of us. Here we go. So I've got
what do I have?
The Ganoderma promotes heart health.
Yeah, that's not the one I wanted. So I'm gonna, do you see a new share yet?
Yep, I see the feet.
Okay, there it is. All right. So this person came in, and this was the first day I saw her, and they were gonna cut her foot off 2 days later. And that's gangrene. And so when you teach about different organ systems, it could be the brain, it could be the heart, it could be the kidneys, it could be the liver, it could be the lungs. There are 3 distinct zones of cells. There are cells that are dead. Well, there's nothing we can do about the dead cells. There are cells that are fine. There's nothing we need to do about the fine cells. But in between are cells that are functional but not functioning. And our goal is to bring those back to life. So, or bring them back to function. So this is what happened to this person's foot in just 2 weeks. And then when we look, this was the final outcome. So by the way, if they cut the foot off, right, how much function would she ever have back in that? And the answer is none. And so, you know, we can't really tell with even functional testing, what portion of the cells are dead and which ones are just not working right. But when we enhance health, we can make a massive difference. So, you know, can we flush out toxins? Yes. Can we control the inflammatory process? Yes. Can we alkalize the system? Yes. Does that enhance oxygen exchange? It does. Do we increase overall energy efficiency? Sure. do we kill off chronic infection? We can do that too. And so there's so many different mechanisms by which it can help, but the real point is that needs to be answered is how much of the tissue is viable and can we bring it back? And my answer is always the same. We won't know till we try. So why don't we give it a shot? So there's definite proven benefit. And beyond the Ganoderma, cordyceps, which happens to be in red tea, also has really wonderful lung benefits.
Question on Ganoderma. I've got on brain cancer.
So Ganoderma is proven against 15 types of different cancers to date, including most recently glioblastoma, which is the most important or most aggressive form of brain cancer. So I'll do another screen share. That's it right there, share. And now we'll go to this view. And so this was a 2019 study. And here's what it said. Ganoderma significantly inhibited proliferation, that's growth, migration, that's local invasion, and invasion, I'm assuming they're talking distant metastasis or spreading of glioblastoma, which is the most aggressive brain cancer, and triggered apoptosis. What does that mean? That means death, a real good death of the cancer cell. So, when you look at that, that can be really, really, really powerful. But we have a story, and like I tell people, I've taught at the International Nutrition and Cancer Conference 3 different times. And if medicine has a great treatment for a cancer, well, you might consider doing it. But if they don't, they may do more harm than good. And so somewhere in here, I've got a good picture of Hannah and her brain, which I'm looking up. There we go. So this will be kind of gruesome, but I'm going to do another screen share. So this is Pete Cohen, and that's Hannah in 2012. And I met her not too much time after that. I wrote the foreword to her book, and she's now, 6-7 years cancer-free. But they came to Houston, Texas from the UK to see a doctor named Stanislaw Brzezinski. And Dr. Brzezinski has a 1/3 cure rate with her type of brain cancer with a type of therapy known as anti-neoplastins. So when they were in Houston, they came to see me. I did the nutrition. Stanislaw Brzezinski did the medicine. And she's a beautiful success story of surviving, when basically no one in medicine gave her any hope of surviving. So if I go back to her surgery picture, that was after a 9-hour brain cancer surgery. There was so much cancer in her head, they couldn't get it all. They said some had infiltrated life-critical areas. And they said, we're sorry, get your affairs in order, you're going to die. But fast forward to today, beautiful, healthy, happy, balanced, making the world better, and sharing what she learned along that journey.
Okay, now we have a couple of questions about pets. Is
Okay.
Ganoderma safe for pets? For instance, I've got one on asking about a cat and one on a dog. And if a 6-pound-old dog could use spores for cataracts?
So first and foremost, I'm not a veterinarian, right? But we did a Zoom called 4 Legs or 2, Ganoderma is good for you. So they did a toxicity study on dogs, and they infused directly into their veins over 4,000 doses a day, every day for a few weeks without any toxic effects. So that's how they figured out it wasn't toxic. But we knew Ganoderma was good for a lot of things. So we had a dog that had a cancer on its elbow. We didn't know it was a cancer. It had a big, big, big swelling. And so I took it to the vet, and the vet, great Texas A&M trained vet, did a biopsy right there, looked at it, he says, wow, Bob, this is a really aggressive cancer. Here's what I suggest. We're going to cut off the leg right at the shoulder and hope it didn't metastasize through their body. And I immediately said, you know what, this dog likes to run. I don't want to do that. And I just left, and we went home, and he's about a 20-pound dog, and we would give him 3 Ganoderma spores a day. Well, the vet had given him an initial prognosis of 6 months. Well, I don't know if it was 6 or 8 or 10 months later, Charlie had something else come up. So I took him back to the vet, and that lump on his elbow had shrunk dramatically. So the vet just looked at me and says, wow, the dog's doing good. What in the world are you doing for him? And I said, well, we're giving him these spores. Well, he started giving them to essentially every type of animal as a first line type of therapy. So it was birds, it was cats, it was guinea pigs, it was whatever. So, we have people that are well credentialed in that are very happy doing that. And I'm not aware of any toxicity for Ganoderma for anything except for yeast, parasites, fungus, bacteria, and cancer. It's really bad for those things, but the cells that we want to keep healthy, it seems to be really good for those. And then the question was about a 6-pound animal with cataracts. Well, I don't know that you're ever going to reverse cataracts. The prevention trumps cure. That's ancient wisdom, but I know it works for humans. I don't know. I suppose if someone were ambitious enough, they could check this out for animals too. But I've had 3 patients this year that had cataracts, that had a cataract surgery where they put some type of lens in their eye, where even if some of these people had worn glasses for 50 years, now they can see at all distances without glasses. So I don't know if they call it, monovision or whatever, but they literally can see near, far, and everything in between with this new lens implant and no glasses even after 50 years. So that's a really nice advancement in medical science and technology.
Wow. Okay, so would it be better to take 6 spores at a time or 2 every 15 minutes? Or like, is there a way to get a better dose?
I would rather spread it out, so that the half-life of most natural molecules is very short. I don't know what the half-life of the bioactives is in Ganoderma, but it's quick enough that you can't get toxic to it. So keep in mind, once you start putting it in your body starts using it and it starts going away, So, would you rather eat all your food in one meal, or would you rather just spread it out? Well, I think we do better spreading it out. And I'm a big fan of frequent doses.
Okay. Someone asking if organo coffee, so we'll just say Ganoderma coffee would be okay for breastfeeding women.
Well, you know what? I have that happening in my family right now. So I've got 2 beautiful granddaughters, and both are nursing, and both moms consumed it. Here's what I like to say: the babies had Ganoderma on board, likely at the moment of conception, right? Because both moms were enjoying it very, very consistently. And by the way, I do know that every grandparent thinks that their grandchild is the most beautiful and the most gifted and the most talented, and we all should feel that way. But I promise you, these are very, very special little angels. And they're super healthy, and they've just had such a good start on life, and a very clean introduction into the planet, rather than let's just say that often it's a toxic introduction, and it gets worse from there. So their parents have gone the extra mile to protect them from all of that, and it shows.
Okay. So Kat's brother had open heart surgery to replace a mitral valve. Would Ganoderma help the condition? He's currently on blood thinner.
Well, that's what they do, right? When they do a valve replacement. And so it's fascinating. My mother had a valve replacement, seems like it was about 15 years ago. She had rheumatic fever as a child, and that can be bad on the valves. And so they had a choice. They said, well, you can get a pig valve or you can get a mechanical valve. If you get a mechanical valve, you have to take blood thinners for the rest of your life because there's a major clotting risk. And my mother said, no, I don't like taking drugs. Give me a pig valve. And by the way, this valve is still working really, really well. And you still have those options. It depends on the cardiologist, but the patient always has a choice. If they put in a mechanical valve, you have a forever significantly increased clotting risk. And even though Ganoderma prevents abnormal clotting and does not promote abnormal bleeding, I doubt that we'll see a study, unless someone really specifically goes after it, to see how it's studied with mechanical valves. The drugs have been studied with mechanical valves, and as long as they keep their clotting parameters in range, they have a definite benefit there. So, can Ganoderma help? Yeah. Is there any known drug interaction? No. Is there any contraindication? No. So do we want all these other things healthier? Sure. I think we do.
Okay. Catherine's husband experiences PVCs when he drinks caffeinated beverages. It's likely that Ganoderma infused coffee. Is it likely that Ganoderma infused coffee would aggravate or help this?
Well, if he's having PVCs with caffeine, that's good justification for not doing caffeine, and also figuring out, you know, and I'm going to take a tangent before I answer that. Ganoderma is good, and I like it, and we showed a case where PVCs were dramatically improved with it. So, you know, that is something that we can possibly take advantage of. But you know, why he's having a challenge with that is interesting. Maybe he doesn't process caffeine very effectively. There's a liver enzyme called cytochrome P450-2D6 that processes caffeine. So we may just need a little more liver support. There's different ways to get that. But, you know, I think that most people, if we optimize their chemistry, shouldn't have to rely on anything foreign or excessive to keep them healthy. But it's easier to stay out of trouble than get out of trouble. And he's on the threshold of having a premature contraction. You don't want to have those. Those can be dangerous. Those can be life-threatening. So, you know, there's plenty of people that couldn't drink non-Ganoderma coffee with a lot of different conditions, including heart, including anxiety, including, you know, different types of flare-ups of certain things. And when they consume Ganoderma coffee, they do a lot better. So give it a shot, see, but, you know, be smart about it. You know, I'd probably do a sip at a time. If I was having PVCs, I wouldn't want to trigger them. And, you know, this is not a plug for business, but if someone, I am for hire for more detailed discussions, you can contact my office, thedrbob.com, and we can dissect your chemistry and history and, you know, put together a customized program for you. This is really more of an informative thing, but I guess if we're talking heart health, we might get some significant questions like this one, right? And by the way, when I saw Ron Worley, he said, well, you have a program for me. I said, well, I can, you know, create a random one, or we can really look at what's going on with your chemistry and customize one. He said, well, that's what I want to do. And guess what? Within 10 days, PVCs went from 1,300 to less than 13,000 to less than 800.
Awesome. What about eczema?
Well, we can't make any claims, right? But so it has an autoimmune circumstance. There's a lot of gut issues. There's the skin is the largest organ of detox. And we've seen plenty of people that have some pretty significant skin conditions improved. But one of my favorite stories is there's actually a very clean skincare line that has Manuka honey within it. And we have a reality TV show star who's a business partner. His name is Tom Brooks. And interestingly enough, they were doing facials in Canada. He happened to be at a hotel where he was, I don't know, doing some type of promotion. And someone offered him a free facial. And he said, well, tell me about it. And he said, well, we have Manuka honey. And Tom said, I want it. So what we didn't know is that he had lived in New Zealand. He was part of a Manuka honey company. He said he was, you know, getting crazy with some friends. And one of the friends got drunk and pushed another drunk friend into a vat of Manuka honey. And he said 2 weeks later, all this guy's eczema was gone, right? So that's what we call an anecdotal story, a case study of one. But I'll tell you what, Tom remembered it. And if you help someone resolve that condition, they're going to remember it. So I would suggest very, very healthy topicals, which are available. And then cleaning the body from the inside out is a really good idea. I don't know if it'll help, but it sure won't hurt. The literature says it can treat and or prevent autoimmune disease. Eczema is in that category.
Okay. When someone is on the Master Cleanse program, which is maple syrup, lemon, and cayenne and water, should they wait to start OG products?
Well, I wouldn't, right? So if you're going to help with detox, we've done lectures on toxicity where it shows that Ganoderma clears some of the worst toxins in the history of the planet. So we mentioned kynic acid in this presentation was a clotting agent, but there's something called MPTP, which induces Parkinson's, and Ganoderma helped with that circumstance. There's carbon tetrachloride, which induces liver failure, and Ganoderma prevented liver failure. There's a chemotherapy called STZ, streptozotocin, which induces pancreatic failure, pancreatic islets of Langerhans, insulin-producing cells failure, and induces type 1 diabetes. But when they gave him Ganoderma, that didn't happen. There are molecules that induce neural tube defects and severe birth defects. Ganoderma prevented that from happening. So we show that it has huge protection against toxicity. When you do a detox, your body's going to mobilize toxins from the cells. I would want everything that I know of that's healthy on board to help my body manage those toxins as they're released.
So we have a follow-up to the breastfeeding question. If
Okay.
the first exposure to Ganoderma is in breast milk, they want to know how that would be to affect the child, I guess.
Better late than never. I'd rather have the child have been exposed to it when the sperm met the egg, while the mom was nurturing that beautiful creature, and then every moment after. But Confucius said it best: the best time to plant an oak tree was 20 years ago. The second best time is now. The best time to have started doing something really, really healthy was way back when. The next best time is now.
Okay, so we have someone asking if Ganoderma can help someone who's paralyzed.
Well, there is a medical study that shows that it helps to rehabilitate injured spinal motor neurons, right? So if the neurons are not dead, if they're functional but not functioning, the data is there in the peer-reviewed literature, especially on motor neurons, that it can help. So classic answer, I'm going to hope it'll help, but it sure won't hurt. If they're functional, functional but not functioning, I'd want it on board. It'd be part of my protocol, that's for sure.
Okay. And the last question we have in here this evening is, can it restore the liver?
The liver is wonderfully restorable. And so the data is there. I have a comprehensive Ganoderma and liver slide from a PubMed study, and I'll pull it up and I'll share it. But you would be amazed at what the medical literature says. That one's fatty liver. That's not the one I wanted. So let's close that one. Let's close that one. Ganoderma, liver. All right. So, boom. Zoom, share screen. Here it is. All right. So there's your PubMed ID. This is registered with the National Library of Medicine, National Institutes of Health. And the hepato, that's liver. So think of like the term hepatitis, right? That's an inflamed liver. So the liver protective effects of Ganoderma lucidum in different liver diseases, including liver cancer, non-alcoholic liver disease, alcoholic liver disease, hepatitis B, inflammation, fibrosis, and toxicant-induced liver injury. This peer-reviewed medical study calls out all of those things. And I shared that the study I had on carbon tetrachloride, when they gave animals carbon tetrachloride, they would progress to liver failure, but when they gave them that and Ganoderma, that didn't happen. So that would be protecting against the toxicant-induced damage. But the liver is one of the most regenerative organs within the body. And Ganoderma, by the way, is known to induce stem cells. Stem cells can become anything. So the data is there that it can be very, very helpful for liver conditions.
Okay. And as normal, a few people have thrown in a couple more. We have a question. We've got four. One of them is asking about erectile dysfunction and PCOS. So two separate things, obviously.
Yep. So ultimately, we want to find out what's causing the problem with erectile dysfunction, right? So stress could actually be it. And Ganoderma is a universal stress buffer. It could be a nitric oxide problem. In fact, that's what Viagra does. It potentiates nitric oxide through an enzyme called phosphodiesterase 5. So Ganoderma, being a nice nitric oxide enhancer, should help with that. Sometimes it's neuropathy from diabetes. And guess what? Ganoderma can help diabetic neuropathy. That's proven as well. So lots of different mechanisms by which it could help erectile dysfunction. Then when we start talking about PCOS primary cause is typically insulin resistance. And Ganoderma, again, can enhance insulin signaling by at least half a dozen mechanisms. And part number 2 on that is it's often due to what's known as xenoestrogen toxicity. Xeno is actually spelled with an X. There's estrogens in plastics, estrogens in pesticides, estrogens injected into animals. And Ganoderma is proven to help to clear these xenoestrogens. And so multiple mechanisms by which it could help both.
Okay, and hemorrhoids.
So this is a fascinating issue, and I'll do a little anatomy lesson. Not that we'll do anything that would be strange or obscure or weird, but you know, my liver actually sits right here, right? And my bowel has a whole series of blood vessels that go directly to the liver. That's called the portal plexus. And before all these poisons in the world, it was estimated that the primary job of the liver was to detoxify the bowel. So some of that portal plexus actually goes very, very close to the rectum. And when the liver becomes congested, that vascular system becomes swollen. And if it gets swollen low enough, you get a hemorrhoid. And so flushing out the liver is absolutely one of the greatest remedies for hemorrhoids. There's also an interesting root, which is called Collinsonia root. What an interesting name, like colon, Collinsonia root. And that is a remarkable hemorrhoid remedy as well. So I use both in combination, and patients have great success with it.
Excellent. And I'm wondering if Lawrence joined us late. He's asking about tumors.
Well, again, it's proven against at least 15 different types of cancer. I could probably bring up the comprehensive on that. And every one of them has PubMeds. So, you know, what's interesting is I've created I wonder if I have that one in there. Let's see where I have that. I'm always a show me kind of guy, so I'm looking for the reference itself. Oh, come on. Okay, this will work. So when you look, this was basically Ganoderma and immune function, and literally you can screenshot this, but Ganoderma is proven against, when we're talking tumors, they could be benign or they could be malignant. In this case, malignant is what we're talking about, and malignant's much worse. But notice it helps against breast cancer and prostate cancer, inflammatory breast cancer, which is different than breast, the bloodborne cancers, leukemia, lymphoma, multiple myeloma, cervical cancer, melanoma, lung cancer, pancreatic cancer, colorectal cancer, liver cancer, glioblastoma, that's brain cancer, endometrial cancer, gastric cancer. So is it proven against tumors? Yeah, and if we go back to the reference on cell proliferation, we showed that nitric oxide was a critical component of cell proliferation, and Ganoderma is a very powerful regulator of nitric oxide. So the answer is it's proven against many different types of tumors. It's proven to enhance normal cell proliferation and replication. So it ought to be pretty good. Carol, you're muted.
I figured that one. Okay, so that appears to be the end of the questions for this evening. So I guess it's time to wrap up.
All right. So, you know, this is my favorite hour of the week. I just love sharing health information, but don't let the information stop there. You know, pay it forward in some way to yourself, to your family, to your friends. The world really needs good information right now. I don't know if you are exposed to some of the information I am, but oh my gosh, people just have paradigms that are broken. You know, they think that health comes in, you know, something outside of their body. It comes from within when we optimize function with natural molecules. The first book that I wrote a foreword to was called Herbal Virtues. And here's the first line: there's a synergy in nature that can't be duplicated and can't be isolated. It's all there. Nature's pharmacy, if we can call it God's pharmacy, has 50,000 edible plants. And we've just scratched the surface with them. But of the ones that we looked at, Ganoderma is called the king of herbs. So it seems to have the greatest health benefit of any plant they've studied so far. Now, with that said, could some other plant have a better benefit for some other condition? It could, right? But this one across the board, no known toxicity, no known drug interaction. And it seems it would help just about anything, not cure anything, but help just about anything. So give it a shot, put it in your body. We do this every week. Next week, we'll be back with a new fun topic. And I'm going to sign off like I like to sign off. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. So good night, all, and God bless.
Thanks, Dr. Bob. Good
I
night.
love you, Dr. Bob. You're awesome.
Thanks, Carol.
Thank
Night.
you.
Carol,
Good night,
Great,
all.
everybody
Have a
unmute.
great week.
Thank you.
Thank you.
Thank you, Dr. Bob.
Thank you all.
Thank you.